Greetings from Nepal Cancer Education Foundation. Breast cancer is the most common cancer in females globally and the leading cause of cancer deaths in women. Awareness, screening, and early detection of breast cancer can reduce mortality and improve survival rates. Today, we discuss all about breast cancer: what, why, and how. Breast cancer can originate from different types of cells, including ductal, lobular, or stromal cells. Uncontrolled proliferation of these cells in any part of the breast is termed breast cancer. The breast is divided into four quadrants and a central area known as nipple areola complex (NAC). The most common site of breast cancer is in upper outer quadrants because there is more breast tissue. Breast cancer is a major public health problem which occurs in every country and led to approximately 6.7 lakh deaths in 2022. It is the most common cancer in women in 157 out of 185 countries including Nepal. Rare in men, approximately 0.5 to 1%. According to Globocan 2022, breast cancer has surpassed cervical cancer as the most common cancer among women in Nepal. As a whole, breast cancer is the second most common cancer in both genders. Breast cancer occurs when cells in the breast undergo mutations, causing them to grow and divide uncontrollably, forming tumors. Cancer can develop from any type of breast cells like ductal, lobular, or stromal cells. Most commonly, a typical hyperplasia in ductal cells lead to ductal carcinoma in situ (DCIS), which is a non-invasive cancer that later develops into invasive cancer. There are many ways to classify breast cancer: histological, invasiveness, molecular type, and so on. The most common type is invasive ductal carcinoma, triple negative, invasive lobular, and inflammatory breast cancer. The less common types of breast cancer include Paget's disease, phyllodes tumor, angiosarcoma, and lymphoma. The exact cause of breast cancer is not known, and no risk factor is identified in half of breast cancer patients. Non-modifiable risk factors include female gender, age more than 40, family history of cancer in first-degree relatives, BRCA1 and BRCA2 mutations, and elevated estrogen levels, early menarche, late menopause. Modifiable lifestyle factors include obesity, alcohol consumption, smoking, etc. Not all cases of breast cancer cause any noticeable symptoms, particularly in the early stages, and are often detected through screening. Symptoms may include a painless heart and immobile breast lump, the most common symptom of breast cancer. There may also be unilateral nipple retraction or discharge, skin changes such as dimpling, puckering, redness, or thickening, and occasionally breast pain. All these symptoms might be seen in other than breast cancer. Ultrasound, thermography, and MRI are useful for detecting breast cancer, especially in asymptomatic women. However, mammography is a well-recommended screening test that decreases mortality and improves survival by more than 30%. If a lump is detected, triple assessment, including clinical examination, imaging, and breast biopsy via cytology or histopathology, are recommended to diagnose breast cancer, which has a very high sensitivity of 99.6%. A breast ductoscopy is used to diagnose intraductal lesions. Other imaging modalities such as MRI, PET scan, or CT are done to diagnose or stage the disease. Breast cancer varies significantly and prognosis depends on the stage and tumor biology. The TNM staging system defines 5 stages of breast cancer, stage 0 to stage 4, based on tumor size T, lymph node involvement N, and distant metastasis M. Tumor biology includes a basic histological grading to complex molecular mechanism regulated by various genes. Each type of breast cancer needs a specific treatment modality. Breast cancer screening is crucial for early detection, offering better treatment options such as breast-conserving surgery, improving survival rate, preventing advanced disease, and ultimately raising awareness for prevention of breast cancer. Therefore, regular mammography is recommended to reduce mortality and improve survival rates by over 30%. Breast cancer treatment modalities include local treatments like surgery and radiotherapy, and systemic treatments like chemotherapy, hormone therapy, tumor targeted therapy, or immunotherapy. The recent trend in breast cancer management involves a multidisciplinary team approach for optimized survival and quality of life. Surgery is the primary treatment for breast cancer. There has been a paradigm shift in breast cancer surgery over the past 4 decades. A lumpectomy removes a tumor and some surrounding tissue, while a mastectomy removes the entire breast. Since Halsey's introduction to radical mastectomy in 1894, breast cancer surgery has evolved towards less radical approaches, guided by numerous landmark trials. Lumpectomy with radiotherapy is the global standard of care. Palliative mastectomy is also done for some breast cancer. External radiotherapy is recommended after breast conserving surgery for the whole breast and for the axilla after mastectomy. Radiotherapy can also be used preoperatively or as palliative treatment. Cytotoxic drugs are used systematically in combination with surgery and radiotherapy, either as adjuvant therapy to eliminate micrometastasis or neoadjuvant therapy to downstage the disease. Chemotherapy can also be used as palliative care intent in advanced or metastatic breast cancer. Hormone therapy is primarily used for patients with estrogen or progesterone receptor positive breast cancer. It is safe and easy to administer and used in all age groups. It provides adequate prophylaxis against contralateral breast cancer and is also useful in metastatic cancer. It reduces recurrence rate, improves quality of life, and enhances survival. Tumor-targeted therapy is indicated for HER2 positive cases. With immunotherapy, the immune system is boosted to recognize and destroy cancer cells more effectively. It can be used in combination with chemotherapy in metastatic, triple-negative breast cancer, and advanced breast cancer. After completing breast cancer treatment, regular follow-up visits are essential to ensure disease-free survival and maintain quality of life. A standard protocol involving symptom review, physical exam, and relevant investigations should be followed regularly. Thank you.